In today's digital age, having a website is a must when it comes to attracting new patients. But what if your website is actually losing you patients? This was the big topic of an April 10th podcast from last year. Now listen to this special Throwback Thursday episode to learn why having an established website is actually costing you new patients. You'll discover 5 ways to freshen and improve your website immediately to start attracting more and better patients. Enjoy. Colin Receiver here for another episode of the Patient Attraction Podcast. Today is Thursday, April 10th. And, if you have an established practice, meaning that you've been around for 7, 10, 15, 25, 30 years in dentistry, that's considered a good thing. You've got a long reputation in your community. If you've got a dental website that's been around for that long, or maybe only 5 or 10 years, it's not. And I'll tell you why after the break. Stick around. I've been designing websites for about as long as there have been websites. Back in the early 90s, I was tinkering and building websites, and we built our first website for a dentist in the mid-90s, 1997 I think it was. And so much has changed since then, both in the back-end side of the coding, how you manage the websites, as well as the front end, the design, or the user experience, as it's called now. If you were an early adopter of the internet and you haven't freshened up your website in several years, Google just gave you an incentive to do so. A few months ago, one of the big head chiefs at Google, Matt Cutts, if you Google his name, you can find out his blog. He's got a daily video that he also releases that pretty much called out older websites. And this is what he said. Older websites may have gotten stale if they aren't regularly updated. Newer sites provide visitors with a better user experience. And since Google is all about user experience these days, new sites will appear higher in the Google searches. Now, we talk to a lot of dentists that have an old website that they say has consistently ranked higher over the years. And I want to touch on a little bit about why that is and what to expect moving forward. It's one thing if you think you have a high Google ranking. What we see with a lot of dentists is they search for themselves and they go, oh yeah, I'm ranking here or there, I'm ranking high. There's 2 primary problems with that in today's world. The first is what you're searching for. Who else is searching for it? Are you the only person? Are you an audience of one that is searching for Chicago dentist? One thing I can tell you after being in the Chicago market for a number of years is every dentist in Chicago thinks the term Chicago dentist is a term that they want to show up for. And I can tell you there aren't a significant amount of phone calls that come from people that search for Chicago dentist. And here's why. A patient in the greater Chicago market that is searching and trying to find a dentist searches for a Chicago dentist to start with. And, those are the 2 most general keywords that are out there. The problem is that somebody that's searching for Chicago dentist has no idea what they want yet. They're not looking for any dentist anywhere in Chicago. Somebody on the south side's not going to drive up north. Somebody on the west side's not going to drive east. Chicago is a huge city. Somebody that searches for Chicago dentist is very immature. As their search process matures and they start searching for South Chicago dentist, or maybe Lafayette Chicago dentist, or maybe Lafayette Chicago implant dentist, maybe their 5th or 6th search, statistically people are going to do 6 to 8 searches before they decide on a provider to go with, when they're looking for a local provider in their market area. Maybe the final search that they do is Lafayette, Chicago, implant dentist, all on 4. That is where you have somebody that is very, very qualified, has very specifically told you what they're looking for. The search results below it are going to be very, very specific, attuned to exactly what they're looking for. And the website that they click on that is then delivered to them, they are going to have an extremely high probability of calling. So what does this mean for you? Well, if you're a dentist that is just searching for random terms out there, the chances that you know exactly what your patients are searching for is very slim. It's not always what makes sense to you as a dentist. Just as, what I say with a lot of dental marketing is that a lot of dentist marketing is more attuned to other dentists, to attract other dentists, than it is to attract patients. If you want to attract patients, you have to think about what they're searching for, and not just what your front office staff or your existing patients say. There's reasons that there's tools out there that can be had for pennies a month, pennies a day, that can tell you exactly what people in your market area are searching for. And that's the kind of data that you need to be getting into to find out what you're searching for. The second reason that searching for yourself doesn't make a lot of sense in today's world is because Google is socializing the search results. And I don't mean that the government's taking over and socializing it like they did healthcare. I mean that Google is socializing the search results based around what your friends in Google Plus are also searching for. Google is localizing the search results. So you being at home or maybe in your office, you may see different search results than maybe a guy across the street, depending on how Google determines your location. Where you are physically at isn't always where Google sees you are at. Another reason that searching for yourself isn't really practical is that Google customizes your search results based on your past search history, things that you have looked at. Remember, Google has aggregated all kinds of information about you, from what you've searched for in the past, where you're sitting at, what you've done, map locations that you've pulled up. Google has a monster of information behind them on everything about you. And they are now customizing search results based on that. So if you have searched for yourself over and over again, and you click into your website, or you just see your search results come up at the top, and then you go back and search again, Google is going to tailor the search results that you see based on where it's seen you go in the past. So if you're just searching for yourself and you wonder, you say, hey, I've got a great ranking, I always show up, you might be the only guy that's seeing that. Appearing high up in the search results is the centerpiece. It's not the only piece, but it's the first piece of your web marketing strategy. Because if you want patients coming out the bottom of your funnel, of course, you've got to have stuff coming in the top of your funnel, and that's people seeing you. So when Google talks, and Google is the big gorilla in the room that controls 70–80% of the search engine market share on the internet, you need to be listening. Here are 5 things that Matt Cutts and Google say that you should be doing to stay competitive with websites. 1 is freshen up the look of your website. Keep it fresh, keep it modern. And that's not just because it's a new shiny object you can spend money on. It's because people are always more attuned to the current modern look out there. Right now, we say that websites last anywhere from 18 to 30 months to stay on the cutting edge. And that's not really cutting edge because, of course, at 30 months, there's a lot of designs out there that people are more used to seeing, a lot of how they're navigated and design cues and the look and the feel of them. So anywhere between 2 and 3 years, you can do a simple facelift on your website. It's not building a whole new website. It's doing a facelift and putting a new design appeal on it, changing some things around and keeping it fresh. Number 2 is pretty much what I just touched on that Matt Cutts said, update the user interface. It's not always about how it looks, but how it functions. Number 3 is add new features. 1, 2, 3 years down the road, there are going to be new developments out there on the internet, new ways that things are done and new things to be done on your website. Make sure that you're staying up with these. Now, I'm not talking about chasing every shiny object that gets released out there, but it's easy to spot which trends are going to be successful or semi-successful, and definitely which trends are just going to be a complete flop when you understand the core of what really drives patients into your practice. The 4th item is continue to tweak your website, update it with continuous great information, blogs, articles, press releases, FAQs, videos, anything you can release to your website that puts out a ping to Google and says, hey, we got some new stuff here, come check it out, is going to keep you ranked higher in the search results. And 5th is keep up with the times. As Cut says in his video, I wouldn't just coast on your laurels. Take a fresh look at your website, or better yet, pick somebody in the industry that you respect or know or have a relationship with, not another dentist, somebody that's a marketer, to give you an objective and informed opinion on what's actually working for dentists and what's not. And look at your website with those two things in mind, because the problem that we see with a lot of websites out there is they are only designed to be pretty. They're just designed to look good. When you're only designing a website, when the only tool in your toolbox is a hammer, and the person that built your website was just a designer, their only objective can be to design you a pretty website that you like and your wife likes and your front staff likes. When you take a look at your website from the objective of, is this sending me new patients? Who cares if it's pretty? Of course, you've got to have confidence in your website. You've got to like it. But it's not about what you think is right. It's not about what I think is right, frankly. It's about what works to generate patients. And take a look at your website. If it's working for you, make sure you're tracking your results. Find out what works and what doesn't. Until next time, keep moving forward.